a patient with schizophrenia, no matter how good their medical treatment may be, is sent out of a hospital to be alone, they're never going to do as well as if they're sent out of the hospital with a family that's concerned. We'll look after them. We'll make sure that the doctors do what they're supposed to do. That's a tremendous plus.
But most discharged mental patients don't have families to care for them in the outside world.
My problem with the voices has got worse in this kind of setting because it's a lot of violence going on around the area. I got in a lot of fights. I've seen a lot of my friends get killed, and a lot of them overdose.
What we see in the large cities is almost the absence of community. It looks like a vacuum, an emptiness, in which lonely, demoralized, alienated men and women roam around in predatory environments that lack humanness and engagement with their suffering.
The Columbia Research Unit can only take in those with families who support them, so people like Dennis must seek help elsewhere. Just across the street from this elite research center is one place where Dennis went to try to escape the dangers of the street, a former military arsenal, the Armory.
I went into the Armory in '89. I actually got tired of getting high. I needed to escape 3rd Street area. Everybody knew me. Drugs was easy to get. And eventually I would have died on the Bowery.
Many of the homeless people who stay here have diagnosed mental disorders, and schizophrenia is common.
Okay. He's cool about it.
Dr. Alan Felix says he is the only psychiatrist in New York City working full-time with the homeless mentally ill.
We can ask the man with the paper if they know.
This man here, let's ask him how he's doing. We're from the CSS program? Have you heard of it?
No.
Okay, we're a clinic right here in the shelter and provide a lot of different services, primarily psychiatric and social services. The shelter is a horrifying place. Very pathological behavior, criminal behavior at times, violent behavior, which goes on a fairly routine basis in the shelters, becomes part of the norm. There are violent street gang members that run the drug trade or may be involved in prostitution rings or in petty thefts. And in that sense, a lot of the shelter life mimics street life.
Unlike Dr. Felix, the majority of psychiatrists who treat severe disorders like schizophrenia remain in their hospitals, where patients are admitted in crisis.
The practice of psychiatry as it relates to the chronically mentally ill still relies very, very heavily on hospitals. We talk about deinstitutionalization, and it really did happen. Lots of patients who were kept in the back wards of terrible hospitals were able to get out. But the whole idea behind that movement was that the community would provide resources, the necessary housing, jobs, support systems, supervision that would allow people who were somewhat impaired but healthy enough to be out in the community to flourish in some way, at least to get by. And the second part of the equation never happened. Patients were released to the streets, but they didn't get the kinds of supports that were shown to be needed in order to improve outcome.
Many people found themselves trapped in a vicious circle, either emergency readmission into the hospital or an unsupported life back on the streets. Several hospitals are trying to pick up the pieces. Manhattan Psychiatric is typical.
It's not psychiatry's role to respond alone to these problems, but it is psychiatry's role to advocate on behalf of patients for what is needed. That kind of integrated, comprehensive treatment system that we know from research can really make a difference. First-rate social support, the presence of resources that provide income supports, housing, sheltered workshops, supervision, halfway houses. Psychiatrists should advocate for that.
While in Italy, the medical profession has started to provide support outside the hospital, in New York City it's been left largely to charities to try to create a few small communities for the mentally ill. Two Franciscan fathers, John Felice and John McVeigh.
I was assigned to a church in New York City by my superiors and told to develop some sort of an outreach program. That was because it was after Vatican II, and this was the church was opening its windows and its doors, as it were. I had no idea what kind of outreach program I was going to develop. I stumbled into this privately owned SRO-type hotel near our monastery, St. Francis, and it turns out that this building was filled with people that had been what we now call deinstitutionalized. These were people who had been stabilized on these new medications, and it was felt they could be released back to the community. Unfortunately, there frequently was no community. There was no family, no support system that would see that they would take the medications. Consequently, they would get sick again, go back in the hospital, be restabilized, back out, go off their medications, go back in the hospital. So what I stumbled upon back in the early 70s as a social problem was not homelessness, but was something called the revolving door syndrome. In fact, what we're creating was a surrogate family, a surrogate community for these folks that didn't have a community, to provide the services that would enable them to stay out of the hospital, help them take their medications, etc.
Hi, Sheila. How are you, dear?
Good. 3, 4, 5, 6, 7. Okay. Well, let's see. Sherry called up. She's going to be late today.
Oh.
The trains aren't running, apparently.
Have a silly day, huh?
Have a silly day?
Ms. Manley.
Do I have $10?
You can. You know what that'll leave you?
What?
$3.50.
Not what?
It'll be a long month. You get very hungry.
Thank you. No, I have some money.
Okay. Enjoy.
Have you ever been to St. Francis before?
No.
That's right. You interviewed them.
Yes.
Well, in order to get a reference here, you need a reference from a psychiatric social worker or a doctor or a psychiatrist. You also need an interview with the staff. And there aren't many opportunities for subsidized or Section 8 housing in the city, in New York City. So if you land in a place like St. Francis, you're very lucky. It's an opportunity for the disabled to live moderately in a city where prices are pretty high.
Okay, thank you.
What's this article going to be about, Freddie?
A wedding is a joy.
Right, and it's about your sister, and is it your stepsister?
She's my in-law.
Your in-law. It's about her wedding.
Well, not just about her, in general, weddings.
The care for serious mental disorders like schizophrenia takes skill, compassion, time, money, and patience, all present on a small scale here, but needed on a far larger scale.
These weird T-shirts.
That's Indian Clima.
Right? The Puerto Rican Indians?
You're a Puerto Rican Indian.
This is something that is an equal opportunity disease, as I want to say. It affects anybody and everybody in our society. Consequently, we all are a little nervous about it because we don't know that it might not be around the corner of our life or the life of one of our loved ones. And I think that's the first reason why people in general get very nervous when they see like a really full-blown schizophrenic.
Well, that's what makes for life a mixture. So.
About whether she can come back or not. Not because she's not psychiatrically clear.
I was in the U.S. Navy, got honorable discharge, and I was worked for the post office and worked for the Veterans Administration. I went for computer school and was hired in computers, but I had 6 breakdowns on 6 different jobs, and I got butchered, I had an apartment at one time. It was nice. I could handle an apartment as far as an apartment goes. But, what are you going to do? Sit in the apartment, I don't watch TV. I can't read. My eyes aren't good now.